Good morning, Chris Ohl, Wake Forest School of Medicine, Infectious Diseases, here with COVID update number XXX. I've lost track. So January's almost half over. Hard to believe. First thing is maybe a little winter weather here this weekend for those of us who live in the Triad area, at least. Good time to get the jigsaw puzzles out, hunker down, and enjoy your family. And not going out, less chance of getting COVID. Always a plus side to those winter storms. How are things going? The case counts, in case you're a case count person here, both in Forsyth County and in Mecklenburg County, 235 per 100,000 per day. That's a substantial percent increase from what it was like 3 or 4 weeks ago, but I think most people have figured that out by now. Guilford's a little lower, 185 per 100,000 per day. Top county here in North Carolina, Wake County. So for all of those Raleigh people, you're winning the race at about 350 per 100,000 per day. Interestingly, Wake County is in the Raleigh area. For most of the pandemic, has had lower case counts than the rest of the state, probably in the bottom third. But with Omicron, it seems to be higher. Here in North Carolina, it's the wildfire concept, like I talked about last week, where a lot of the urban areas got Omicron first, and the wildfire spread out to the more rural areas around us. And it is out there now, so if you look at the northern Piedmont and foothills in our area, those numbers aren't too much different than what we are around here. It seems that the increase in the numbers is starting to slow down. I've noticed that over the last 5 days. So of that huge increase in percentage over the last 14 days, most of that was over the last week. So we may be getting up close to our peak. And I actually think that we'll probably peak here in the next week. Why do I say that? Well, a lot of reasons. One is that if you follow other areas that are a lot like we are, they have peaked or are already starting to come down, particularly the United Kingdom. Their case rate's dropping fairly quickly right now, actually. And then if you go up to the Mid-Atlantic and the New England states, and you look at most of those states, they seem to have rounded the curve at the top. Now, just because you rounded the curve doesn't mean we're out of the woods, because obviously it takes a while to come down. Case rates are still very high, still lots of people getting COVID, and that'll continue for a little while. But it looks like the predictions that the peak will happen in January will be true. And by the end of the month, probably substantially down. I think that, though, once we get below 50% of what the top of the peak is, that the decline in numbers will slow down a little bit, just like what we saw with Delta and what we're seeing now in South Africa. So there'll still be COVID around for some time, and it'll be Omicron. Omicron won the race, won the war between the supervillains, and that is over 95% of what we're seeing now here in North Carolina. There are still some parts of the country that still are wrestling with Delta, and Omicron isn't quite as predominant. And most of that, though, is in the upper mountain states and non-coastal western states. So they're a little bit behind us. Hospitals, how are we doing? We are very, very busy. The number of COVID patients in our hospital is the highest it's ever been. It's greater than what the peak was last January, probably by about 15 to 20% higher. There's been a lot out there about a lot of it misinformation, some of it true, and I'm going to try to explain about people in the hospital with COVID. So the majority of people who are getting hospitalized with COVID are there because of COVID. It's COVID that put them in, well over half. But yes, there are some people in the hospital where COVID is a contributing, but maybe not necessarily a primary reason. Those numbers are lower, probably about maybe 20 to 30%. But think about it, it's not always quite as easy as, simple as what social media tries to make it out. So if you have somebody admitted and they've had a stroke and they also have COVID, how is COVID contributing to that? It probably is. We in medicine who admit people with acute serious medical problems understand that there's oftentimes an incident, many times an infection that tips a person over the edge. And that could be influenza, that could be another virus, it could be a bacterial infection. In the instance now, it could be COVID. And it's enough to take somebody and who's been doing all right and tip them over, and then they have an acute medical problem. And so, it does contribute. But you also have to be aware that, when you have 10 to 15% of a community, such as Forsyth County or Winston-Salem or Charlotte, that has COVID at any one time, and that's probably about what it is now. It's roughly around 10 to 15% of people have COVID right now, that if you get admitted for a car accident, you're going to have a 10 to 15% chance of testing positive for COVID, just because that's what the rate is in the community. So there are some people in the hospital who incidentally just are found to have COVID, and that's not why they're there. That's a minority of people, probably around 10 to 15%. And then roughly about 60% or so are there because of COVID, and that's the real reason that brought them in. And then the others are people where COVID contributed. So you gotta interpret the social media out there that COVID is the reason why our hospitals are so busy. So even if you get admitted for a car accident and you just happen to test positive for COVID, we still have to put you in a special room, in a special area of the hospital. We still have to put on all of our personal protective equipment, and we still have to limit visitors. So it still makes us busy, and it still contributes to the workload. One of the other reasons hospitals are so busy right now is because a lot of our staff are getting COVID. Even though we have vaccine mandates, breakthrough infections occur. When a breakthrough infection occurs, our staff do have to isolate, and some of them have to quarantine if they're exposed. So that cuts down on the number of people that come to work, and that makes it busier. That's no different for a hospital as it is for anywhere else. Maybe you notice that your favorite foods aren't in the grocery store, or that your kid's substitute teacher might be somebody from the admin building rather than from the substitute teacher pool. And that's just because everybody has got people out for workplace reasons. And so it is disruptive. I told you way back before the holidays that the big thing with Omicron, even though it may be a little less severe, it is still going to be plenty disruptive. And we are certainly seeing that. How much longer are we going to be in this? Well, I mentioned earlier, I think we're nearing peak here in North Carolina. It probably will happen in about a week, and then over the 2 weeks after that, the numbers will decline to a point where it's a lot more comfortable for us. Hospitalizations take a little bit longer to go down. Obviously, people come to the hospital, take a while to get out of the hospital. And deaths actually follow further behind. Will we have as many deaths from the Omicron surge now as we did last year? during January? No, I don't think so. We have a lot more people with some immunity due to vaccine or having had infection in the past. And Omicron does seem to be a little less likely to cause pneumonia. Does that mean it doesn't cause pneumonia at all? Also seen that misinformation out on social media. People stating, don't worry, Omicron won't cause pneumonia. Tell that to about a bunch of the people who are in our hospital right now with Omicron pneumonia. Yeah, it still happens, but it's less likely. What are the risks for getting severe Omicron infection? Still number 1 risk. Number 2 risk, number 3 risk, number 4 risk, and number 5 risk are all being unvaccinated. And that's really the elephant in the room as to whether or not you're going to get severe Omicron. The numbers are you're about 17% more likely, 17 times more likely to die if you're unvaccinated and you get an Omicron infection than if you were vaccinated, particularly if you were vaccinated or boosted. How are our schools doing? Well, the universities so far are doing pretty well. A lot of universities have had booster mandates before coming back. I'm pretty optimistic that's really going to make it a lot better for the universities. It'll also mean that the students who do get infected are going to have COVID colds, and they won't be out of class as long because the 5-day quarantine and isolation period will apply to them, and it'll apply to them safely. The public schools, there's a fair amount of virus going around out there. And it's not all just COVID, but there's also other viruses, including influenza. So there's a lot of student absenteeism right now. The schools are implementing the 5-day quarantine and isolation for COVID, and that the CDC recommends and the communities are doing. I agree with doing that. I think that'll help get kids back in school. And when if they wear the mask afterwards, there's really no risk in doing so. But the big thing for schools, just like for all other workplaces, are how can you handle the staff and teacher shortages, because staff and teachers are getting COVID and COVID colds too. So that's the biggest thing for our school systems to wrestle with. And as long as they can keep up teaching our kids in class, and they can keep the staff in there, hanging in there to do that, then they'll be able to stay open. That's the primary determinant. By the way, if you're a parent and your kids are in school, send an email to your kids' teachers this week and let them know how much you appreciate them and what they're doing. Because I certainly do. And it's time to do that. Testing. So, testing to get tested for COVID. Is it a COVID? Is it a cold? Or is it the flu? The only way to know is to get tested, for sure. Tests have been hard to find. Help's coming on that. And let me explain. First of all, I think the federal government's going to be mailing out some home tests. I would imagine that's by the end of the month. So everyone should get something, and we'll see how long that takes. There has been help already from the state getting testing sites up and going. Greensboro Coliseum now, and I know there's some testing sites that have been set up in Charlotte too. And then the Forsyth County Health Department has started testing some. Star Med is set up another testing site. So tests, we're getting more. Turnaround time is still long. It's probably somewhere around 72 hours, depending on the vendor for the testing site. But it's hanging in there. Next week here with Atrium Health, Wake Forest Baptist, we will be setting up sites with the assistance of the state. The timing of it's going to depend a little bit on the snowstorm and the after effects of it. But the hours will be pretty open, 9 to 6 on weekdays, a little bit more limited on weekend. On Saturday, I think Sunday they'll be closed. So look for that to come out open next week. Where will those be? It looks like they'll be in Wilkesboro. Preliminary, I think they'll be at the airport there, here in Winston, Bowman Gray Stadium, and in High Point, maybe Providence Place, but stand by for the final word on that. And keep fingers crossed that the snowstorm won't slow down that. People who are symptomatic and asymptomatic are eligible for testing, and they're testing down to the age of 2. And it'll be PCR testing, and the turnaround is supposed to be 72 hours or less. So if it's less, then that'll be some help for those people who are international traveling, who are having a devil of a time right now finding that test that they need to do international travel, usually within 48 to 72 hours. A little bit on therapy. What do we have to treat COVID right now? We have one monoclonal antibody, satoramab. The other monoclonal antibodies don't work against Omicron, despite what some governors have said. And so satoramab's the only one. It's in short supply. It's basically being allocated and rationed out by the government. The final authority here in North Carolina is the state. We get an allocation within Atrium Health, both sites in Charlotte and up here. And then we can then give those and infuse those in our monoclonal antibody infusion centers. Right now, the main people who are eligible to get that are people who are severely immunocompromised or moderately immunocompromised, and a few exceptions for others that may be at the very extremes of age or very frail and elderly. Same thing with Paxlovid, the oral drug that's can be available by prescription, basically being rationed out to the same people. Why are we doing this? Why can't everyone get it? There's just not enough to go around. So we give it to the people who it means the most for, and that's for saving lives. And if you're severely immunocompromised and if you get COVID, it's a big deal. And so that's who we're giving it to right now. Supplies of both will slowly increase. I think it'll be kind of on the same ramp up that vaccines increased last year. And every month it'll more than double the number that we have. And by the time we get into summer, really anyone who gets COVID, I think, who is at higher risk of complications, including hospitalization, will be able to get treatment. Once Paxlovid and another antiviral that's coming out in the near future is available, widespread, I think monoclonal antibodies will fall by the wayside just because it's simply easier to get a prescription and go to the pharmacy than it is to arrange an infusion in an infusion center, and it's certainly cheaper. A little bit about what is it safe to do right now? Well, you know, I'm kind of the mindset right now, if you don't really have to do it, put it off till February. If you are thinking about going out to dinner, put it off to February. Sorry, restaurant owners, but it's probably a good time to do that. Obviously, when you're eating, the masks come down. Boy, if you're a guy, combine it with Valentine's Day. You get two attaboys for that. If you're thinking about Church services, maybe be virtual for a couple, 3 weeks, so on and so forth. This weekend, that'll be easy because it'll be real snowy anyway. But after that, I think. So once we get through the end of the month, I think we can start loosening up some. I'll tell you when that's okay. If you have to do it, go ahead and do it. And that's okay. If you need to go to work, go to work. If you need to get groceries, so on and so forth. So it's not really a lockdown. It's just kind of being prudent about what you're doing right now. What about fitness centers? Well, fitness centers, there's a lot of unmasked people in fitness centers, a lot of unmasked people breathing heavily because they're doing fitness. I think it probably is worth postponing getting your fitness center membership back up. So take that New Year's resolution and put it off a month. You have permission from me to do so. Otherwise, work out at home, work out outside, take a walk, go skiing, get your fitness in a place other than a fitness center. It's okay if you can wear a mask, particularly a high-grade mask like a surgical mask, or even an N95 in a fitness center, then it's probably okay. So just to reiterate what we talked about masks last week, and this is all over the place as far as expert advice, and the CDC is supposed to weigh in on it this week yet. And so I'll just sort of reemphasize what I said last week. The best mask is the one that's worn. And so wearing a mask, any mask, is better than wearing no mask. And that includes, if you have it below your mouth and nose, that's like wearing no mask. So any mask is better than no mask. And if you really want to protect yourself, or you really need to protect yourself, then a higher grade mask is better than a cloth mask. And what's a higher grade mask? It's basically a surgical mask or an N95 mask. N95s are the best. So we in healthcare use N95s when taking care of patients who have COVID. And when I'm staring a COVID patient's mouth and making him say, ah, I'll have an N95 on, and you know what? It protects me. So if you have an N95 on, it really doesn't matter what the people around you are wearing. If you want to protect yourself more, wear an N95. If you're a teacher, wear an N95. If your kids aren't wearing an N95, doesn't matter. You're protected. The downside of N95s is they're more uncomfortable and harder to wear for long periods of time. So as I mentioned last week, it's okay to mix and match. You're doing low-risk things, put on your cloth mask or wearing a surgical mask. If you are in areas where it may be a little bit more likely that you may be exposed to COVID, go ahead and put the N95 on then. So if you're a teacher, when you're in class, wear the N95. If you're working at a desk with 4 other people in the room after school, maybe go to the cloth mask then. So it's okay. People are being too dogmatic about this, I think. A little bit of common sense goes a long ways on it. It may be a little bit hard to find N95s, not necessarily because we're having a shortage across the country, but because they really haven't been in the distribution system. Also, when I say N95, KN95 is basically the same thing as long as you're buying a real one. Roughly 40% of those that are available on the internet are counterfeit. So choose wisely. The last thing about masks is if you're still wearing a cloth mask or a surgical mask, it's got to fit. I have one that has a wire up here that goes around my nose, so it fits. I can tell because it goes in and out when I breathe. Obviously, right now, I got people standing 20 feet behind me, so that's why I can unmask so the mics pick up when I'm talking. But make sure it fits and that you're wearing it. So if 30% of our population wears no masks at all, then everyone wearing an N95 who is wearing a mask isn't really going to change much. But so it's mostly for you and your personal protection. Who really needs to be personally protected? Immunocompromised people, people with a lot of underlying medical problems, older people, and or people who are living around them. So last couple topics. One is that even though this is not necessarily COVID, we need people to give blood, and because people are staying away from blood donation centers because of Omicron, it's always harder in January. The holidays have more trauma, car accidents and such, so our blood supply goes down. So let's go out and give blood. Find your nearest blood donation center through the Red Cross and through your local health systems, but people need blood, and time to give. And then second to lastly, I've noticed there's been more and more websites out there that are peddling COVID treatments that don't treat COVID. And so I really want to caution people about that. We talked about the treatments that work, and that's the sotrovimab, the monoclonal antibody, antiviral Paxlovid, another antiviral molnupiravir, which is a little bit harder to use, and then remdesivir, which is mostly used in hospitals, occasionally in infusion centers as outpatients. That's it. That's all we have really to treat COVID right now for acute infection. So anything that I didn't just listed is really unproven or very, very sketchy. So an example, even though people still think it's good, ivermectin, that's a drug for worms. It's not a drug for COVID. Doesn't work. I've seen websites advocate use of certain diuretics or other androgen hormones, steroids, so on and so forth. That's dangerous. Not only do they not work against COVID, but they can hurt you if they're not used under a doctor's close supervision. So just put on that little skeptical hat when you're looking at these websites. They're out there to make money, and that's why they're there. I wanted to end a little bit on an editorial note. There was an article in the Washington Post the other day, I think the New York Times carried something too similar, about all the confusion. They were lamenting. There's so much confusion out there, everywhere. Confusion about COVID, what works, what doesn't, what test, what not, what treatment, what. And they were laying some of the blame on public health. Now, it's okay to put a little bit of blame on public health, but I will tell you that it's not been easy. There's two big reasons why there's so much confusion. One is social media, and it's not all just people wanting to spread misinformation. Some people are actually, doing, got their heart in the right place, but the information they're spreading may not be right. The other is a combination force between the media and experts. And the media sometimes goes out thinking about a message that they want to get out there, and then goes and finds the expert that they want to talk about that. And so you end up getting expert opinion that's biased towards what the media wants to hear. Some of this is so that they can sell more advertising or get their ratings up or sell more papers or get more hits on the web. The experts aspect of this is leading a lot to confusion. And I bring up the mask thing because you can find all sorts of expert opinion. And these are real experts, real epidemiologists. You still have some people who are out there in my world, in the epidemiology world, saying we should be on full lockdown. We're having some people say, and you can find an opinion article that says, for somebody with an MD or an MPH after their name, and they'll say, you know what, we really should just be living life and not worrying about anything. And so when you get all this disparate expert opinion, it leads to confusion. And that's just, so, I think a lot of experts just need to tone it down. And that's my editorial opinion. Maybe even me. But when that happens, then really credible experts who have really looked at the data and who are really looking out for us in public health tend to get drowned out or criticized. And this is one of the things that happened with the CDC here in the last 3 weeks. I know a lot of people down the CDC. I've worked with the CDC for a long time. I have, very inside knowledge about how the Centers for Disease Control works. Same with the NIH and these other public health entities. They are very careful, and they really look at the information and data. And when they put something out, it's vetted. And so when they change isolation time, there's a reason why they recommended that. And to have a bunch of experts second guessing them and criticizing them is just not helpful. It just increases confusion as to what people should be doing. Getting information out is always hard. Yeah, there's communication missteps out there. But when there's 100 media sources that are ready to jump on your communication misstep, it doesn't help anyone. So be a little patient, have some understanding. Experts, think about what you're saying, and try to be balanced, try to be unbiased, and leave the emotions at home. So sorry for an editorial comment, but I just thought I had to speak to that because it seems to be that this is happening more with the Omicron surge than it's happened with other surges in the past. So with that, Dr. Ohl needs to go away for a couple days next week. And it's not because I'm withdrawing as an expert, and so next Thursday we'll take a week off. And then when I come back in 2 weeks, I'm pretty sure that numbers will start coming down in our area for Omicron. Hang in there. Got a few more weeks to go before those numbers come down enough for we can start to be comfy again. So with that, have a great snowstorm.